Greetings to everyone. Happy to meet you again in the learning series. Now, we are going to learn about the medical social work practice in different settings, which is very important. A medical social worker, how do they work in various settings of their practice that will help people to lead a good life. The medical social work practice in diverse healthcare settings, including hospitals, outpatient clinics, nursing homes, rehabilitation centers, hospice centers, and home health agency. The practice involves a broad range of activities such as psychosocial assessment, counseling, advocacy, case assessment, and connecting patients and families with a vital community resources to address social, emotional, and practical impact of illness. They work with diverse patient populations such as family, women, children, the elderly, and individuals with chronic illness, disabilities, or mental health challenges. Let us learn about the definition and the goal of medical social work. A medical social worker is also known as a healthcare social worker. Helps patients and their families cope with illness. They act as advocates, ensuring patients' emotional and social needs are met throughout their medical treatment. The key responsibilities of medical social workers are, which include psychosocial assessment, providing counseling and crisis intervention, managing cases, coordinating discharge plans, educating patients and families, making referrals to community resources, and advocating for patients' rights. The guiding principles for medical social workers are from National Social Work Association, Mental Health Act, and National Commission for Allied and Healthcare Professional Act, which outline the standards for medical social work practice. This emphasizes ethics, cultural competence, interdisciplinary collaboration, and address social determinants of health, the socio-economic and environmental factors that affect health outcomes. Now we are going to see about common settings for medical social work practice. Hospitals, outpatient care centers, nursing facilities, skilled nursing facilities, home health agency. In each settings, they play a vital role and different role. In hospital, inpatient units including emergency, oncology, and intensive care for outpatient services. The outpatient care centers providing support and resources for patients with chronic condition or specific treatment. In nursing facilities, medical social worker assisting residents and their families with adjustment and access to care. Home health agency, they support patients and families to manage chronic illness and access services. The other settings that are rehabilitation facilities, hospice center, mental health clinics, and substance abuse facilities. These are the other common settings where the medical social workers plays a vital role to engage the patients who are coming there and make them to feel that they are leading a beautiful life. The rehabilitation center, medical social workers plays helping the individuals recover from injuries, illness, and treating and giving them various social services. In hospices center, they provide emotional support, counseling, and resource for patients, families facing terminal illness. In the mental health clinics, the medical social workers offering support for patients and often related to physical and health issues. In the substance abuse facilities, helping clients with substance abuse problems, managing their health, and finding appropriate treatment. So these are various roles in various settings our medical social workers are playing. The hospitals The common roles that we play is they perform psychosocial assessment, coordinate discharge planning, provide crisis intervention. For example, a social worker in an emergency department meets a patient who attempts to suicide. They conduct a crisis assessment to provide immediate emotional support and coordinate an admission to an inpatient psychiatric unit for stabilization. In health clinics and outpatient centers, the social workers plays the roles of case management and care coordinating, diagnosing, treatment, connect patients with resources so that they can have a proper health treatment for their problem that they are coming. For example, a dialysis center, a social worker helps a patient with the struggling with the transportation to appointments. The social worker connects them with a non-emergency medical transport service and provides a short-term counseling to address adjustment challenges. In mental health and substance abuse facilities, the medical social workers plays the roles and responsibility to develop and implement treatment plans, provide a group therapy and individual therapy, and conduct a safety assessment and connect the clients to community support system. For example, in a substance abuse facility, a social worker runs a weekly relapse preventing group and provide individual therapy to address the underlying trauma contributing to clients' addiction. In nursing home and healthcare, the medical social worker helps clients live independently and link to various services which they can access and lead a better life. The example for this, a home health social worker visits an elderly patient recently discharged after a fall. They assess home safety, recommend grab bars, arrange for meal delivery, and connect the family with the local caregiver support group. The last one, hospice and palliative care, the common roles has been played by the medical social workers. They provide emotional, spiritual support, help with end of life planning, and lead a grief counseling for patient and families. Example, in auspices, social work provides individuals and family counseling to help a family process a terminal diagnosis. They also assist the patient in completing an advance directive to outline their end of life wishes. Now we are going to see specific hospital departments where a medical social worker plays an important role to lead the patients who are coming for a care so that they can have a peaceful life and peaceful treatment in the medical setting. The maternity and children hospital where the medical social workers support families through childbirth, postpartum care, and address needs of children with developmental issues or others requiring long-term care. In chronic illness, for example, HIV and AIDS, cancer, the medical social worker help the patients and families cope with emotional and social impact of chronic disease, manage treatment adherences, and navigate the healthcare system for these patients who are going through this chronic illness. And in the blood bank and tissue bank, they assist in the social and emotional aspects of organ and tissue donation and transplantation. The last one, trauma care centers, the medical social worker provide immediate crisis intervention and long-term support for patients and families experiencing traumatic injuries. Specific hospital departments, whereas we see rehabilitation centers, palliative and auspicious care, pediatric and geriatric departments, where the medical social workers plays a various role to lead the patients to play a vital role in engaging them and giving them counseling, connecting them with the proper treatments. The rehabilitation centers, the medical social worker help individuals with disabilities regain independence through counseling, emotional support, and connecting to a community resources. In palliative care, they provide psychosocial support to patients and families facing a life-limiting illness, focusing on comfort, dignity, and quality of life, which is very important for a human being to lead a life in the society. The pediatric and geriatric department, the medical social worker address the specific social and emotional needs of children, adolescents, and older adults, including issues like abuse, neglect, and elder abuse. Now, we are going to see about various other institutions where medical social workers also have to work to give a better way of life for the other institutions. The institutions for mentally and physically challenged, they provide support, counseling, advocacy for individuals with mental and physical disabilities, helping them integrate into community. In community health centers, the medical social worker on health promotion, disease prevention, and address social determinants of health with community. Then in education institution, the medical social worker counsels students facing academic, social, and emotional challenges and work with families to create a supportive environment for learning. The last one, residential institutions, where the medical social workers provides a social work service to residents of long-term care facilities, group homes, and other residential settings. So these are other institutions where medical social workers plays a vital role. The key roles and activities of medical social workers in various different settings, let's see those key roles and activities. Across these different settings, a medical social workers perform crucial roles including psychosocial assessment, which means evaluating the emotional, social, and practical needs of patients and their families. The second role they play, crisis intervention, which they provide immediate support in emergency or crisis care setting. And third is counseling and support, which the medical social worker providing emotional support and counseling to help individuals to cope with illness. And the fourth one is advocacy, which they champion patients' needs and ensure they receive appropriate care. Then the medical social worker also plays the role of case management, where they coordinate services and resources to meet the patient's needs, and they also play a resource referral role where connecting the patients and families to community-based services, financial assistance, and other necessary supports. And the last two key roles are liasoning and discharge planning. In liasoning, the medical social worker acting as a bridge between patients, families, and other medical care team. In discharge planning, the medical social worker assists patients and their families in preparing for transition from hospital to home or another facilities. So, these are the various roles of medical social worker in different settings. They play in various ways. It may lead to various help support to the people who are in need. Each setting has their own a vital and important role, where medical social worker plays a very vital role in coping with various illness of patients. Thank you all. If you like this video, kindly subscribe and like it.